never thought I was going to be in a position where I wasn't able to have health care and take care of myself, and that's a horrible feeling.
It is very important for us to have a clinic like this one that can help us when we need to see the doctor, even if we don't have the money to pay.
The biggest healthcare crisis we face here is the number of uninsured people that we have in Harris County. We have the highest number of uninsured people in the state of Texas. And without insurance, we know that people don't access healthcare as frequently as they should. And when employers come and look and decide if they want to move their businesses to this city, one of the things they look at is what the healthcare system is.
I think that healthy communities are thriving communities. If you stop and think about it, you have a company, you have people that are healthy, they show up every day, they work hard, they're productive, and it's just sort of that trickle-down effect.
I think it's vital. It's vital. It's what keeps a community going. It's what makes a community flourish. It's what makes a community.
You know, when your only resource for treatment is an emergency room facility, obviously it's no longer an emergency room. It's a health clinic. And I think, you know, we're all striving to make an emergency room a true emergency facility.
That is why a facility like Legacy is so vitally important.
Legacy provides comprehensive health care from the very young to the elderly.
And they are all treated equally and all given the most extraordinary attention and care. It's really something what they do.
You can go, no matter what your income is, and get treated for whatever ails you, and also have preventative care. And I just think it's an amazing model, and they've been able to just achieve tremendous things.
Our largest clinic is in the Montrose area. It's been there for over 20 years. We saw a need in the 5th Ward, so we partnered with the City Health Department and went into that neighborhood to provide primary health care.
I come to Legacy for my regular checkups. I'm a mother of 5, so I like this because it's in my neighborhood and it's close to my house, and also when I need an appointment, I don't need to wait too long for the appointment. The people here, it's very nice, and also they are bilingual. If we don't understand something, I know that they are going to help me.
We really focus on the populations that are most at risk for diabetes, for hypertension, and for HIV.
My husband found out that he has diabetes, and they have a nutritionist. The nutritionist gives him list what to eat or what to quit eating. It's been a lot of help for him.
I've always had a personal interest and personal convictions for AIDS service organizations, having lost many friends during the AIDS pandemic. And I was very impressed by Legacy right out of the box, just by the tenacity of the people and the excitement and the sincerity. You know, they perform their task truly from the heart.
Legacy specializes in HIV, and knowing that, it gives you a lot more peace of mind. I'm not just going into a place to see a doctor and have medicine prescribed. I'm going into a place where I'm interacting with people who understand.
I think the real boundary to HIV and AIDS care is the stigma and the ignorance, really, of the general population thinking that this pandemic has been eradicated.
I knew that I had been exposed. Someone that I had known had died relatively quickly after me knowing them. I stayed in kind of a state of not really wanting to deal with it, mostly just kind of hiding from it. A lot of the changes that have happened for me in my life, physically, emotionally, psychologically, have been because the services of Legacy were available.
So you've got somebody who is, you know, on your side. They're there for that specific reason to help you through this time. The mental aspect is as important as the medical.
I have friends and I know people in the community who have benefited from Legacy, and so, you know, we're here. We're here because the service is available. I don't know what life would be like without it. I really, you know, I'd hesitate to try to comment on that. I would think there would be a lot of people in pretty dire straits.
Legacy is going to continue to expand into various communities in Houston, so more and more Houstonians can be treated.
Our vision for the future is, first, we're building a new building on California Street in the Montrose area that will house our Montrose Neighborhood Clinic as well as all of our administrative offices, and that we have clinics in the neighborhoods that are most in need in this city. Satellite clinics like we have in the 5th Ward and that we're building in Gulfton to serve everyone in need in this city. There should be a Legacy Community Health Services in every neighborhood.
If you haven't been to the Legacy facilities, it's really quite an amazing operation. It's staffed by just tremendous physicians. I know that there are other communities that look at the Legacy model and say, wow, how did y'all do this?
There is a certain, I don't want to call it warmth, I want to call it light that comes out of Legacy. You know, it only takes one candle to light 1,000 candles. They've lit my candle and probably a few others as well.
Given the fact that 32% of all Houstonians are without health care, in order to expand Legacy and in order for Legacy to reach out and be able to treat those people and care for those people, they need our support, and they need it now and now more than ever.